Good day and happy Memorial Day. I'm Dr. Ruth Roberts, your pet's ally, and I hope that you are all well and having a wonderful week or weekend. I guess it's a longer weekend for you. We've got a couple of questions in the Crockpet Diet group, so let me just hop right into that. And first of all, Margaret, thank you so much for this video. I just love this. Yeah, that's a testament to true love for sure. So glad to see that. Chrissy, welcome to the group. And yes, there is a diet for pets that are in kidney failure, and it is reduced in fat, it's reduced in protein, obviously. As far as an acute episode of pancreatitis, what I would do is kind of work more on the pancreatitis right now. So here's the frustrating thing about kidney failure is that many veterinarians will tell you that your pet is in kidney failure, and when in reality the values are just slightly elevated. So let me just check and make sure. So what I would suggest, and thank you, Kathy, yeah, if you can afford a consult, that's a great idea, because this gets a little complicated. The other thing is too, y'all, if you're not members of iPets Ally, this is where we can go into a couple of deeper dives if you don't need a full consultation. So what I would suggest doing is don't worry so much about the protein at this moment. That will help you, help him, I should say, heal a little bit faster. And the other thing I would do is when you make the food, instead of 6 tablespoons of oil, I would take it down to 2 tablespoons of oil and use extremely lean cuts of protein. So this is, again, it's designed to be a temporary situation to help get him through the pancreatitis part. And as that gets better, the deal with pancreatitis is that we should feed less fat than they were eating before, but what the internist really can't tell us, unfortunately, is how much less. So we just kind of go to a level that we feel is comfortable. And I think this is, again, where using your intuition is really, really important. So Lolly will tell you that she sorted that out for her own pets. But use super lean cuts of protein, add 2 tablespoons of oil, and then if your pup is just starving, you can indeed add more carbohydrates, so things like rice, potatoes, quinoa, things of that nature. And then Phoebe, the kidney stones, it's not so much about what to feed as it is what urine pH is. And again, these are questions that are better in iPets Ally, because there's 2 types of kidney stones. One requires an alkaline urine to form, and the other one requires an acidic urine to form. So there's a lot more than just a straight answer to that. So what I can tell you is feed as much water as possible and get things diluted. And there's some other things that that I'll recommend often. Thanks, Jamie. So I hope that is helpful, Chrissy, and welcome to our group. I'm sorry you're having troubles, but I think we can get you some help. The next question is from Lolly, who has done a ton of work. So she is worrying about Bogart. All right, so here's the thing to remember. If you're really concerned about phosphorus, there's more phosphorus in meat than there is in beans. So, and then the other thing is, y'all, if the volume cooks down, if you add more meat, that means you're just going to have more protein in there. And so what you have to do is either decrease the volume that you're feeding so that the diet stays in balance, or add something else in, like vegetables, things of that nature. So Yes, and olive oil doesn't have much linoleic acid, which is why we rotate through the oils. So what you need to do is make sure you're adding in more veggies or something of that nature to occupy the volume more. Remember, the calories are going to be the same regardless of the volume, which is really the kind of the frustrating part. And Georgia is right. It does seem to cook down, and and that's it. So you're adding volume to your batch by adding water, and that's perfectly reasonable because again, the caloric content is going to be exactly the same. So right on, Georgia. Good solution. I forgot that one. And I think, let's see, so we've got 4 new members to the group this week. So Chrissy, we've already welcomed. Helen, welcome. Kelly and Elaine, great to see you here. I think that's what I've got. I'm going to pop back over to the documents that Hannah sent me and make sure I haven't missed anything, but I think it's kind of a short day today. Yeah, I think that's it. So again, y'all, thanks so much for coming, for being a part of our group. Any questions you need help with, post it in the group. As you can see, you can get some help pretty quickly from folks that have been around the block a few times. And that's what I have. So until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally. Thanks.